Have you ever wondered what really happens inside your body when a bone breaks? It's a moment that can be both shocking and painful, but there's a fascinating story behind every fracture. Our skeletal system is an incredible framework, strong, flexible, and designed to support us through life's daily challenges. But like any structure, even the toughest bones have their breaking point. When a force suddenly exceeds what our bones can handle, a fracture occurs. Sometimes it's the result of a dramatic accident, like a car crash or a sports injury. Other times it's something as simple as slipping on ice or missing a step. The impact might come as a direct blow, a sudden twist, or even from repetitive stress over time, each one capable of overwhelming the bone's natural strength and integrity. Sometimes it's not just the force that matters. Underlying health conditions like osteoporosis or nutritional deficiencies can quietly weaken bones, making them vulnerable to even the smallest incidents that wouldn't normally cause harm. A fracture is more than just a break or a crack. It's a signal from your body that something has gone wrong and needs immediate attention and care. The story of every fracture begins with a force, whether sudden and violent or slow and repetitive, that pushes a bone past its natural limits, causing it to give way. This event sets off a complex and remarkable healing process as your body works tirelessly to repair the damage. It's a powerful reminder of both our vulnerability and our body's incredible ability to recover. Understanding these limits and knowing how to protect and strengthen your bones is the first step towards safeguarding your skeletal health for a lifetime of movement and activity. Let's talk about osteoporosis, a silent thief that weakens bones without warning. It's a condition that often creeps in quietly, without any obvious symptoms, until something serious happens. Many people don't even realize their bones are at risk until it's too late. Healthy bones are dense and strong, providing a sturdy framework for our bodies. But osteoporosis turns them porous, almost like Swiss cheese, riddled with tiny holes. This makes bones fragile and much more likely to break, even from minor bumps, falls, or simple movements that wouldn't normally cause harm. Our bones are living tissue, constantly being renewed. Specialized cells called osteoclasts break down old bone, while osteoblasts build new bone in its place. This ongoing remodeling keeps our skeleton healthy and resilient. When we're young, our bodies build more bone than they lose, making our skeletons strong. But as we age, especially with osteoporosis, bone loss starts to outpace bone formation, leading to weaker, thinner bones over time. This is especially common in post-menopausal women because lower estrogen levels speed up bone loss. However, men aren't immune. Osteoporosis can affect anyone, regardless of gender. The real danger? You don't feel your bones weakening. There are no warning signs until a fracture occurs, often in the hip, spine, or wrist, which can lead to pain, disability, and loss of independence. That's why prevention is so important. Make sure you get enough calcium and vitamin D and include weight-bearing exercises like walking, jogging, or dancing in your routine to help keep bones strong. Remember, osteoporosis isn't just an old lady's disease. It's a serious condition that can affect anyone, young or old, male or female. Even younger adults should be aware of their bone health. Awareness and proactive care are your best defense. Talk to your doctor about your risk factors and consider getting a bone density test if you're concerned. Don't wait for a break or a fall to take your bone health seriously. Start making changes now to protect yourself in the future. Protect your framework before it's too late. Your bones are the foundation of your body, and they deserve your care and attention. Let's take a closer look at hairline fractures. These are tiny, almost invisible cracks in the bone that can be surprisingly easy to miss, even on detailed X-rays. They're sometimes called stress fractures because they develop gradually, often without a single obvious injury. These stress fractures are classic overuse injuries, showing up most often in athletes, runners, and dancers who put repeated pressure on their bones through intense training or practice. When you repeat the same movement over and over, especially when your muscles are tired and can't absorb shock as well, the stress gets transferred to your bones. Over time, this can cause tiny, microscopic cracks to form, which are the beginnings of a hairline fracture. The main symptom to watch for is localized pain that's focused in one spot. It usually gets worse with activity, like running or jumping, and feels better when you rest. There's often very little swelling or bruising, which makes it easy to mistake a hairline fracture for a simple sprain or muscle strain. Many people keep going, thinking it's nothing serious, but that's a big mistake. Most hairline fractures happen in the weight-bearing bones of the lower leg and foot, like the tibia, fibula, or metatarsals, because these bones take the most impact during activities. Healing a hairline fracture is all about giving your body time to repair itself. That means stopping the activity that caused the injury and resting as much as possible. In some cases, your doctor might recommend a walking boot or even crutches to keep weight off the injured bone and help it heal properly. If you ignore a hairline fracture and keep pushing through the pain, that tiny crack can grow and eventually turn into a complete break, which is much harder to treat and takes longer to heal. So, it's important to listen to your body. If you feel persistent pain, especially in your legs or feet, take a break and let yourself recover. Sometimes, rest really is the best medicine. Don't try to push through pain or ignore warning signs. Respect your body's limits and give yourself time to heal. Early care and proper treatment can prevent bigger problems down the road, helping you get back to your activities safely and stronger than before. Now for the severe comminuted fractures, where a bone shatters into 3 or more pieces. These are caused by high-impact trauma, car accidents, big falls, or major sports injuries. Imagine dropping a plate on tile. It doesn't just crack, it shatters. Comminuted fractures often damage surrounding muscles, nerves, and blood vessels, making treatment complex. Healing requires surgery. Surgeons realign fragments and secure them with metal plates, screws, or rods. Recovery is long and challenging, often involving extensive physical therapy. Sometimes the hardware stays in permanently. These injuries are a true test of both the body's resilience and modern medicine's capabilities. A comminuted fracture is no joke. It's a puzzle that takes time and expertise to solve. The road back is tough, but healing is possible. It's a powerful reminder to respect the forces our bodies face. Spiral fractures happen when a twisting force breaks a long bone in a corkscrew pattern. Common in sports like skiing or soccer, these injuries occur when the body turns but a limb stays planted. On X-rays, the break spirals down the bone, making it unstable and tricky to treat. In kids, even a simple fall can cause a spiral fracture. In adults, it usually takes more force. Stable fractures may heal with a cast, but unstable ones often need surgery. Proper alignment is crucial. If the bone heals wrong, it can affect limb function. Physical therapy is essential to restore strength and motion after immobilization. Spiral fractures show how dynamic forces, not just impacts, can break our bones. Compound fractures, where bone pierces the skin, are true emergencies. The open wound exposes bone to bacteria, raising the risk of serious infection. Immediate medical care is critical. The wound must be cleaned, antibiotics started, and the bone stabilized. Treatment often involves surgery and sometimes external fixators to hold the bone steady. Recovery is long, with risks of infection and poor healing much higher than with closed fractures. Multiple surgeries and extensive rehab may be needed. Compound fractures remind us how vital our skin is as a barrier. When that barrier is broken, the stakes are much higher. Let's talk prevention. Calcium is the hero of bone strength. Your bones are a living bank for calcium, and dairy products are some of the best sources. When you don't get enough, your body withdraws calcium from bones, weakening them. Milk, yogurt, and cheese help keep your bone bank full, especially during childhood and adolescence. Think of calcium as the bricks in your bone house. Without enough, you can't build strong walls. Consistent calcium intake is key to lifelong bone health. The habits you build now pay off for decades. Drink your milk, your future self will thank you. Calcium isn't alone. Vitamin D is its essential partner, helping your body absorb and use calcium. Sunlight triggers vitamin D production, but you can also get it from fatty fish and fortified foods. Without vitamin D, even a calcium-rich diet won't help your bones. Magnesium, vitamin K, and protein also play key roles in bone structure and strength. Leafy greens, nuts, and lean meats round out a bone-friendly diet. But diet isn't enough. Bones need stress to grow strong. Weight-bearing exercises like walking, jogging, and lifting weights stimulate bone-building cells. It's a classic use it or lose it scenario. Combine good nutrition with regular activity for the best results. Build a team of nutrients and movement to keep your skeleton strong. That's the real secret to fracture-proof bones. We've explored fractures from subtle cracks to dramatic breaks, and learned how conditions like osteoporosis silently weaken bones. The key lesson: bones are strong, but not invincible. They need care and the right resources. Nutrition is foundational. Calcium and vitamin D are non-negotiable, supported by other nutrients. Building peak bone mass in youth is a lifelong investment. Physical activity signals your bones to grow stronger. Don't skip it. Combine smart eating with movement for the ultimate defense against fractures. You're not just preventing breaks, you're building a resilient, future-ready you. That's a solid plan for lifelong strength.